Hello and welcome to Local Doctors on Call. I'm Alex Redmond. When you look in the mirror, does the face that greets you match the way you feel? If you're of a certain age, then probably not. Your face is the first thing that people see when they meet you. You only have one face, and now you can do something about it. Tonight we're talking about options for minimally invasive procedures with no downtime to full facelifts, and most importantly, how to make sure that the surgeon you pick is qualified to perform them safely. Botox, Restylane, Perlene, which is the best? Well, here to answer all your questions about facial rejuvenation is Dr. David Mobley of Sarasota Plastic Surgery Center. He is a board-certified plastic surgeon by the American Board of Plastic Surgery, the American Board of Facial Plastic Surgery and Reconstructive Surgery, and the American Board of Otolaryngology, which means that he's an ENT or an ear, nose, and throat man as well. So that's really important when choosing a surgeon. Welcome to the show, Dr. Mobley.
Very good to be here.
You know, we were talking a little bit about that. When someone's considering getting facial plastic surgery, the fact that you are an ENT, which means that you understand the inner workings of the face, so you're not just working on the cosmetic or the outside. Why is that important?
Well, I think it gives you a good head start on the anatomy and an understanding of how the face works, how the muscles of the face work. And as you enter plastic surgery training, you have a real head start on the other residents because you have been sort of living the face for the past 4 years. So in doing so, what you learn in plastic surgery just adds to that. And so I think you come out of your training with even more experience and more valuable training than you would if you had not been an ENT person to begin with.
All right, our phone number is 361-4675. That's 361-4675. Go ahead and call in with your questions about facial rejuvenation, including Botox, Restylane, Perlene, or full facelifts, because it's a great opportunity. 361-4675. Now, we're talking about board certifications. There are doctors out there that are performing very scary facial plastic surgeon, and they are not board certified to perform plastic surgery of the face or plastic surgery. How does that work? Why is it so important to be board certified?
Well, in most all states, including Florida, you only need to be a physician in order to begin doing plastic surgery. So you don't need to have formal training in plastic surgery. And so there are all sorts of specialties now that are picking up and starting to do plastic surgery, even though their training may be a lot less. I believe that most people that want plastic surgery want it done by a plastic surgeon. And if they knew who they were going to, they would prefer it be a plastic surgeon. But there is a number of physicians out there who are very good at, in a sense, fooling the public into thinking they're plastic surgeons and that they're trained similarly to us when they're not.
All right, let's talk a little bit, if we may, about a case that happened not too long ago. This happened in Sarasota. It's very sad, of a young lady that went in for breast augmentation. How did this happen, and who performed this surgery? What type of a doctor did this?
Well, it was a oral surgeon who was doing breast augmentation, and he was doing it in an office setting with a unlicensed nurse doing the anesthetic, and she became over-anesthetized and died during the procedure, which was just a true tragedy. It did not need to happen. If she were having that procedure in a certified facility that was safe and by an experienced plastic surgeon, I dare say that it wouldn't have turned out that way.
Now, I had the opportunity to come to your surgical suite actually the other day, and you showed me around the whole place, and you had the recovery beds right there, and you even have a nurse that's in charge of everything. You have a head nurse that is the surgical suite nurse.
Right. I think it's important to follow very safe procedures when you're talking about elective cosmetic surgery. Number one should be safety, and then number two should be effectiveness. The procedure should work well, and you should get your, so to speak, money's worth from the procedure. But if you are not having a safe procedure, then I think it's important that you seek out a board-certified plastic surgeon and a certified facility in order to increase safety.
All right, if you have a question that you would like to ask Dr. Mobley, our phone lines are open, 361-4675. That's 361-4675. Great opportunity to talk to him without having to go in yet. And we have Sue on the line. Hi, Sue. Welcome to Local Doctors on Call. What would you like to ask Dr. Mobley?
Hi. I just want to say shame on you for promoting this.
Thank you for your call. Obviously, somebody that doesn't want to get plastic
She
surgery.
probably doesn't
That's
want
fine.
it. Yeah, that's
Well,
it's not for everybody.
Hey, well, just to let you know, I mean, we're going to talk a little bit about minimally invasive techniques. I
Right.
happen to be a consumer. I use Botox.
Mm-hmm.
I tell all the women in my life. So, and anybody that cares about it, I'm sure that there are people that may not want to get it, but for somebody, as I said in the intro, I'm very, very happy with the way that I look,
Right.
and I need a little bit of help. And I am of a certain age, and I decided that when I looked in the mirror, I wanted to look the way I felt. I feel extremely young, I feel vibrant, I feel really healthy,
Right.
but when I was looking in the mirror, I was noticing that certain areas of my face were falling.
Well, I think the key thing is to remember this is an all-voluntary program. We don't want patients to come in unless they're absolutely certain that's what they want. And we're not trying to fundamentally change anybody's appearance. We're not trying to change who they are. And I think, in fact, most people are happy with their lot for the most part. But as we age, there are things that come up that detract from who we think we are and how we think we are supposed to look, or how we're used to looking. And so I think in that case, to take away those detracting things is just trying to put your best foot forward. And I don't consider it vain or unusual to do that.
I certainly don't either. I think that you have to do it for yourself, and the most important thing is that you have to have self-confidence. And if this is something that's going to make you feel better, you have to like what you look at when you look in the mirror. And some people are comfortable with the way they are.
Right.
I'm not. I like a little bit of Botox, a little help, and it doesn't hurt, ladies, by the way. All right, so let's go back and talk about facelifts. What is a full facelift?
Well, the full facelift is the procedure that lifts the lower two-thirds of the face. And so I always like to say, if you do this in the mirror, you're lifting your cheeks with your fingers and your neck with your thumbs. And if you do that and that looks much better, then that's what a facelift corrects.
Would that mean that someone would then be a candidate for a facelift if they wanted?
Yes, they could be. And it's important to have a consultation before you decide that. Go to a board-certified plastic surgeon, explain what's concerning you, and let them tell you what the options are, whether you need the full facelift or something else.
All right, our number is 361-4675. We'd love to hear from you. And we have Janice on the line. Hi, Janice. Welcome to Local Doctors on Call. Go ahead.
Good evening. I'd like to ask your opinion about blepharoplasty and how successful you believe it is in terms of the lower eyelid, and is it a permanent solution to removing the puffiness under one's eyes?
Yes, blepharoplasty can be performed on the upper or the lower eyelid. And the lower eyelid is particularly successful at removing bags. In fact, I call it a sag and bag procedure. And I think most patients get good correction for about 20 years with one procedure. So often, once you have your lower lids corrected, that's the only time in your life you'll need that. So it's a very successful procedure. The recovery is almost no pain, and it takes about a week to 10 days to get rid of the swelling. And so most patients can sit down to dinner with friends in a couple of weeks and look fine, like they haven't had a procedure. So I would call it highly successful, one of the most frequent procedures we do.
All right, thank you for your phone call. And if you have a question that you'd like to ask Dr. Mobley, pick up the phone and call 361-4675. That's 361-4675. Okay, so we were talking about a full facelift, which is when you can actually pick up the lower part of your face and put your fingers on your cheek and raise it up. It would take a few years off.
Right.
What's the difference between a full facelift then and a mini lift?
Well, a mini lift is for that patient who may not need both the neck and the cheeks lifted. There are patients who maybe are younger patients or who only have laxity in one area or the other, say the cheeks or the neck, and they can often do a procedure that's less involved, less invasive, less costly, and will still give them very good improvement. So we don't want to try to fit the procedure to the patient. We want to give them just what they need to correct the problem that they have. And so when the patient comes in, I will go over all of those options with them. And a little faster recovery when you have a facelift or neck lift, and a little less costly also.
All right, Dr. David Mobley of Sarasota Plastic Surgery Center is here tonight answering your questions about facial rejuvenation, and we have Ann on the line. Hi, Ann. Welcome to the show. Go ahead with your question.
Yes, my question is, I'm 46 years old, and I'm considering having the upper eyelid lift, and approximately how many years can I expect to get from that?
I think with an eyelid lift, commonly patients feel they look about 10 years younger. And I think that's obviously a very much an estimate, but it's usually fairly accurate. More commonly, patients will complain that they feel they look tired, or patients or friends come up to them and ask them when they're tired, when they've had a good night's sleep. And I think in that situation it relieves that problem. With the upper lids, it's mostly extra skin, and so you trim away that extra skin. Very straightforward procedure. The procedure is performed in about 45 minutes, and an almost painless recovery. So again, a very common procedure, and often one of the first procedures we've performed, usually right in the mid-40s. So
thank you for your phone call, Ann. Our phone lines are open if you'd like to call 361-4675. That's 361-4675. Dr. Mobley will be answering your questions about facial rejuvenation. We're talking about all different things: facelifts, mini lifts, Botox, Restylane, Dysport.
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 Yes.
Now that's the
Close.
thing that we hear along with Botox. How do you decide if you're going to get Botox or Dysport?
Well, since both products work extremely well to relieve wrinkles around the eyes, I go based on first of all, what the patient asks for. And then if they've had better luck or effectiveness with one or the other, we'll use that. Occasionally you'll see a patient who seems not to respond to one, but does respond to the other, and so you switch to the whichever product works the best. Aside from that, they're very similar products. They both work very well. They're competing companies, so they both have claims that they work the best, but I don't see big differences between them.
All right, our number is 361-4675. That's 361-4675. And Dr. Mobley will take more of your questions when we come back from the break, so stay with us. Welcome back to Local Doctors on Call. I'm Alex Redmond, and Dr. David Mobley is joining us tonight and telling you everything you want to know about facial rejuvenation, including facelifts and also Botox, Restylane, Perylene. And our number, if you'd like to ask him a question, because we're live, 361-4675. That's 361-4675. And we have Bunny on the line. Hi, Bunny. Welcome to the show.
Thank you. Nice to be here. I'm honored. First of all, I'm a nurse, and I've always wanted to work for a plastic surgeon. But at any rate, my question is, the gravelly skin around the lower lip and winds around to the other side of your lower lip as well. It makes your skin look much older. How do you get rid of that?
in general, the best approach to getting rid of the, we call it cobblestoning, because the skin begins to look like a cobblestone pathway, is to use laser. We have a new laser that's called a fractional CO2 laser. It's very good at taking away those surface abnormalities, including wrinkles and cobblestoning, and it seems to be the most effective for relieving that problem.
All right.
And, okay, cobblestone wrinkle, it's called cobblestone. And what is the name of the laser?
It's a fractional CO2 laser. Fractional CO2 laser. And it's the most recent form of lasering. The recovery time is shorter, 4 to 7 days. You do have some pink discoloration for a period of time, but it's very good at getting rid of wrinkles and surface abnormalities. It's the best, most effective treatment we have for those.
All right, Bunny, thank you for your phone call. And if you have a question, now's a great time. Pick up the phone, call 361-4675. That's 361-4675. And ask your questions about facial rejuvenation, how you can look younger and have the face that you like greet you back in the mirror. Doctor, we're talking about the things that people get sometimes during lunchtime, those lunchtime lifts or the lifestyle lifts or the AccuLifts. We hear all of these buzzwords. Is there something about that, a little red flag that should pop up? Or?
Well, I think the fact that any procedure that has either a trademark or somebody says they invented themselves or is heavily marketed on late night TV, on infomercials, should be a red flag in and of itself, because I think most board-certified plastic surgeons who are performing state-of-the-art gold standard procedures don't do that. So I think that alone is a red flag.
All right, our number is 361-4675. 361-4675. We are live tonight. The lifestyle lifts, AccuLifts, and then there was one lift that I heard about where they actually put a thread